Assalamu alaikum all. I am Dr. Iswana and I am going to talk about Dapsone, which is an important drug for the treatment of the leprosy. I have associated Dapsone tablet with a character named Smurf. You all are very well known with these cartoons which we used to watch in our childhood. So Smurf is white colored Dapsone tablet, but when it is away from its home is its mushroom, which is red colored RBC, and when it lacks G6PD, that means when there is deficiency of G6PD in its home, that is RBC, it gets angry, and with anger it turns blue. So blue color conferring cyanosis, which is the result of methemoglobinemia, and it is an important side effect of the Dapsone, and it is more evident in G6PD deficient patients. We will discuss methemoglobinemia in coming slides. So coming towards Dapsone, it comes in tablet and gel formulations. Dapsone is basically a 4,4-diamino diphenyl sulfone, which has been used since ages for the treatment of the leprosy in combination with rifampicin and clofazimine. Talking about its mechanism of action, it has antimicrobial as well as anti-inflammatory properties. Now, how does it confer its antimicrobial activity? This can be understood well by this diagram. In this picture, you can see Dapsone impairs microbial synthesis of folate from para-aminobenzoic acid by competitive inhibition of dihydropteroid synthetase. This action occurs in cell walls, so it inhibits further replication of the bacteria, fungus, and protozoa, and it is used as antibacterial, antiprotozoal, and antifungal agent. Next action is anti-inflammatory, which is caused by inhibition of the neutrophil function and release of chemical mediators. So it is used in neutrophilic inflammatory dermatosis because of this property. This picture is showing its use in leprosy, toxoplasmosis, leishmaniasis, malaria as antimicrobial agent, and its anti-inflammatory action is also shown as well. This slide is showing its metabolism, which is mainly by urinary excretion with 14 to 18 hours half-life, and more than 85% is absorbed orally. FDA approved indications are leprosy, dermatitis herpetiformis, and pneumocystis jirovecii prophylaxis in immunodeficient patients. Off-label indications are dermatosis with neutrophilic infiltrate, for example, linear IgA bullous dermatosis, erythema elevatum diutinum, leukocytoclastic vasculitis, pyoderma gangrenosum, sweet disease, aphthous ulceration, granulomannulare, and acne. It comes in strength of 25, 50, and 100 mg tablet, and in gel formulations it comes in strength of 5% and 7.5%. The WHO recommend dose of Dapsone for leprosy is 100 mg daily for adults. In case of multibacillary for 12 months, and in case of paucibacillary it is for 6 months. And in children the dose is 50 mg daily. In case of multibacillary 12 months, and in case of paucibacillary it is for 6 months. This is the multi-drug therapy regime for leprosy, which is showing the doses of the clofazimine, rifampicin, and Dapsone in children and in adults in case of paucibacillary and multibacillary patients. For most of the dermatological conditions, an initial dose of 50 mg daily should be given for the first 2 weeks to ensure there is no immediate adverse effect, and then it is adjusted according to the clinical response. In older patients, 25 mg daily is used. Clinical response in dermatitis herpetiformis is prompt, and skin lesion starts to resolve in 48 hours. The maximum dose should not exceed 300 mg per day. Remember that the rash of the dermatitis herpetiformis is gluten dependent, and the mainstay of therapy is the long-term strict gluten-free diet. In case of children, the dose is 1.4 mg per kg per day. So we have to do baseline investigations before starting the Dapsone therapy. In baseline investigations, we have to take the complete history. We have to do the physical examination. Then we have to do complete blood count, liver function test, renal function tests, G6PD levels, and urinalysis.